Next is Adhata Udavarta pratishedham adhyayam व्याख्यास्यामः यथोवाच भगवन्तमन्त्रिः अधश्च ऊर्ध्वं च भावानां प्रवृत्तानां स्वभावतः न वेगान् धारयेत् प्राज्ञो वातादीनां बीजविषुः. In the body physiological mechanisms, there is a normal movement of the contents of the body. Either it could be the contents which are taken in or the contents which are expelled out will be moving upwards or downwards depending upon the utility, like, or depending upon purpose. Like the food which is consumed will be moving from the mouth to the stomach towards the intestines in an antegrade fashion, whereas the urine which will be expelled out as such, the erectations, when there is a erectation, the gas which is erected out would be expelled out as such. So this way, or it could be the physiological movements where both the movements do exist in a synchronized fashion, as in case of the respiration, where there will be a breathing in and breathing out, that regular respiration, where there will be a upward and downward movement of the contents as such. All these are occurring normally with a physiological control, with a synergistic action. It's a very complex mechanism, and we call this as physiological reflexes. Physiological reflexes, and then the reflexes which we see in the clinical examination by hitting a tendon, these are not very significantly different. But when we say physiological reflexes, the mechanism occurs as a subconscious mechanism, subconscious activity, but at the same time there will be voluntary control overlapping over it. Those are considered as physiological reflexes, and these are named as Vegas. Vega are such physiological reflexes which do exist in the body, and of course the counted Vegas in Ayurveda are very limited, whereas in the normal physiology as we study, you will have these kinds of movement throughout in every area. And these Vegas are very specifically, Sushruta has mentioned a few, whereas in Vakpata you have a few more. Vata Vinmutra Jimbha Ashtu Kshavatu Udgara Vami Indriyehi Vyahanyamanehi Utrihi Udavartaha Niruchyate. Now these Vegas, if they are suppressed, now because there is a voluntary control over the Vega, these Vegas can be modified or suppressed. Like primarily, micturition is a involuntary activity. At the time of the birth, it is totally involuntary. But gradually there will be a learning process, and based upon that learning process, there will be some voluntary control. So these are the typical physiological responses where there will be voluntary overlapping over a involuntary activity. Swallowing is a involuntary activity, but when you swallow, what do you swallow? That's a voluntary component. So when you have these kinds of overlapping things, they are considered as Vega. And Sushruta has named the Vegas as Vata Vega, that's the flatus, passage of the flatus, with stools, passage of the stools, where again there is a underlying involuntary component and then overlying a voluntary component. Mutra, Jimbha, the urination and yawning. Ashru, tears. Now tears, of course, whether it has to be having a voluntary control or not, it's not really a voluntary control, but there is two forms of the controls. One, the local reflex, where some stimulus to the eyes would be producing irritation to the eyes, will be producing the tears. At the same time, some emotional components, when you are very hurt as such, there could be the tears discharged, and that's how it has to be considered, that two layers there, though the second layer is not purely voluntary, but there is some conscious control over it. Then Udgara, the erectations, vomiting reflexes, these are the Vegas, and if they are suppressed, then they may produce the disease called Udavarta. From the current physiological point of view, the importance of these phenomena, that physiological reflexes are known, but suppression of the physiological reflexes resulting in the disease is not really understood. But abnormalities of these are already known, and there are a good number of disorders where we will come to that part, which are related to these physiological reflexes. तस्य अभिजास्य व्यासेन लक्षणं च चिकित्सितं त्रयोदशविधश्चासु भिन्नः एतैस्तु कारणैः. Their lakshanas, the features which are produced due to suppression of these Vegas are counted as 13 varieties of them, and their general clinical symptoms are Adhana Shula Hridaya Pratham Shirorjam Shwasam Mativahikam Kasat Pratisha Gala Grahamsha Balasa Pitta Prasaram Ghoram Kuryad Apano Abhirda Swamarga Hanyat Purisham Sukadak Mukhadak Shipegwa. If the Purisha Vega is suppressed, that defecation activity is suppressed, and that's even when you have an urge for defecation, if it is suppressed and it continues to be there, it may produce adhana, distension of the abdomen, pain and discomfort in the chest, headache, breathlessness, hiccup could also be produced, cough or even nasal discharges or spasm of the neck also can occur, or any other kapha-pitta vyadhi diseases also can occur due to abnormal apanavata. The gati of apanavata would be affected due to the passage of the stools. Now, as I told you about, the reflexes would be of two categories, autonomic and somatic. The somatic again is, autonomic is also called as visceral, now whereas somatic is not visceral. The visceral reflexes are controlled by synergistic activity, that like the bladder and bowel controls are often the quoted examples. Synergy is an interaction or cooperation giving rise to a whole what is greater than simple sum of its parts. Like that's the whole important is there will be a synergic activity to regulate this, particularly in bowel regulation stools. There is a definite synergic activity. The synergistic activity starts with the parasympathetic stimulation when the rectum becomes distended, and the parasympathetic stimulation gives a sensation to the brain that there is a loaded stools in the rectum. Then there will be a voluntary activity of making the abdominal muscles contracted, and there should be at the same time the sphincter should be relaxed. Now these phenomena put together, they produce a synergistic activity where the sum of these activity like abdominal muscle contraction and the relaxation of the anal sphincter together will help in defecation, whereas a sphincter distended alone without much of abdominal contraction may not result in defecation. It may allow the flatus only to pass through, and so on. So abdominal muscle contraction without the sphincter dilatation also would not result in defecation. That's what we call as the sum of its parts producing some effect which is greater than, or the sum of the individual activities. Now every physiological activity represents synergism of different organ systems. Dyssynergy is a disturbance of muscular coordination that results in abrupt and uncoordinated movements. There is the important condition, all these conditions where there is an abnormality of the synergistic activity is called as dyssynergy. If there is no synchronization or sequential propagation of these activities, that produces abnormality, and I would consider these as Udavarta. Udavarta, I would be considering all that group of the disorders which are called as a dyssynergy. Autonomic dyssynergy is one of the established conditions in the current pathology, which is a very critical condition, often produces in these spinal injuries. The clinical signs of the typical the Purisha Vega Dharana, suppression of the physical urges would be Atopashuro, Parikartanancha, Sangaha, Purisha Setha, Urdhvataha, Purisham Asyadapitibani Reti, Purisha Vega, Abhete Nasya. If the Purisha Vega's defecation is suppressed, it can produce the initial symptoms like distension of the abdomen, pain and anal irritation, or urdhvata, retrograde peristalsis, and in a very severe condition there could be a fecal vomiting too. Now from the current point of view, the dyssynergistic activities occurring in the gastrointestinal tract can be categorized as the motility disorders of the stomach. The motility disorders of the stomach are like gastroparesis or delayed emptying or rapid gastric emptying, dumping syndrome as there is a rapid movement of the food, or idiopathic vomiting, or it's also called as functional dyspepsia, or cyclic copetic syndrome. These are conditions which we have discussed and we discussed about the GET tract abnormalities otherwise. The intestinal motility disorders are grouped as intestinal pseudo-obstructions, colonic inertias, scleroderma-like condition, irritable bowel syndrome, intestinal amyloidosis, spinal muscular atrophy which can result in the intestinal motility disorder, short bowel syndrome, intolerance to lactose or fructose, Small intestinal bacterial overgrowth, which is another of the condition which is becoming more popular now or gaining some popularity now as such. Small intestinal fungal overgrowth or megacolon. Another important issue related to the rectum is the rectal dyssynergia. The rectal dyssynergia is where defecation dyssynergia. Defecation dyssynergia, in the normal situation when the defecation occurs, there would be a increase in the pressure in the rectum, whereas the anal pressure should be reduced and anal pressure would be negative, so that the contents will be passing through. When there is some abnormality, and these abnormalities are categorized into 4 types of dyssynergias. Type 1 is when the patient defecates, the anal pressure as well as the rectal pressure increases. Instead of the anal pressure getting reduced, the anal pressure also increases, which prevents the passage of the stools. Whereas in type 2, the rectal pressure doesn't increase, but the anal pressure increases during defecation, which also can affect the defecation. Type 3 is where the rectal pressure increases, but the anal pressure doesn't increase, it remains the same, or anal relaxation doesn't occur. That's what called as type 3. Type 4 is the condition where both the pressures will be very low. The defecation activity would not produce any results, which occurs in old age or other neurological pathologies. So, dyssynergias of defecation are one of the well-established conditions which can produce the defecation abnormalities. Is something which we have discussed during the constipation in some other context. And all these I would consider them as Udavarta. That's all the point. The important is Udavarta is not a single disease entity. You can identify any of these conditions, or there is an abnormality of that synchronization of the activity, dyssynergia-like activity, or abnormality called as motility disorders. All of them can be considered as Udavarta. A similar issue is in case of the Mutravega, bladder dyssynergias. Though there is no specific word called as bladder dyssynergia, the abnormality of the bladder motility could be produced, according to Sushruta, would be due to suppression of the urinary urges. From the current point of view, this practice is not understood, like are not maintained, mentioned as it, like suppression of urges would result in dyssynergia. That part is not mentioned. The real causes of the dyssynergia often are not really noted. But the features of the Mutra Vega Abhigata resulting in Mutra Udavarta would be Mutra Sebege Abhyate Narastu, Kritsheda Mutram Kurute Alpamalpam, Metre Gude, Vamshana Basti Mushkanabi Pradesh, Shwata, Athapi Murdhi, Anadha Basti Chabhavanti Libraha, Shulascha Shulehi, Iva Bhinna Murtehe. The possibilities are many. Either there could be a difficulty in maturation, or there could be patient may be having increased frequency of maturation with the smaller quantities of urine excreted every time, or there could be pain in the perineal area, genital organs area or perineal area, or even in case in the abdomen, or occasionally even the headache also. There could be even retention of the urine and anabdhavasti. The whole bladder may become distended, and such conditions are categorized as Mutra Udavarta. As far as the maturation reflexes are concerned, as I told you, there is a primary underlying autonomic sympathetic and parasympathetic activity. The sympathetic and parasympathetic activity help in distension of the bladder as well as contraction of the bladder when there is a need for maturation, or when the bladder is full. When the bladder is full, the parasympathetic nerves, they get stimulated and they can send a message to the hair center, and in the cortical center would be stimulating or controlling the muscles of the perineal area, and that results in the act of maturation. Abnormalities are what we call as neurogenic bladder conditions. Abnormalities of these nerve controls can produce different sorts of bladder abnormalities, and they are categorized as uninhibited bladder condition, where the patient would have very increased frequency of maturation every time. Even before the bladder is full, the patient may have an urge for defecation, and he is not able to hold on for a long duration. Immediately, the patient has to go for a maturation. Automatic bladder is when the bladder is full without a voluntary control, the urine is evacuated. It's when there is a loss of the motor neuron activities as such, or abnormal motor neuron activity. Autonomous bladder is when the bladder, even if the bladder is not full, there would be some leakage at some intervals. The patient may have a sensation of micturition, but the patient is not able to control the micturition. The moment there is a sensation of micturition, the urine would be leaked out. A sensory paralytic bladder is when the patient is not able to sense that the urine is full. Motor paralytic bladder is when the patient can sense that the bladder is full, but he cannot evacuate the urine. There will be retention, or there is a bladder neck dysfunctions where usually the amount of the urine secreted would be lesser, and there could be residual volume of the urine resulting in distension of the bladder in due course of time. So these are the different types of the neurological bladder conditions, or which we have also called as neurological bladder, and I consider all of them as the Udavarta Prabhedas. Then comes the Ashru, the tears. Anandajam shoka samudbhavancha netrodakam praptam amunchato hi shirogotvam nayanamescha bhavanti tivraha sahapi nasena. The person who tends to have a tear discharge due to emotions, and if these emotions are suppressed, the tear discharge also is suppressed, then that can produce a heaviness in the head. It can result in diseases of the eyes, or even penasa. A chronic nasal discharges also can occur due to the same. Of course, from the current clinical point of view, we do not have identified such a condition where the emotional disturbances resulting in the tear gland secretion. But the tear gland secretions can be abnormal, can produce the abnormalities of the eye functions, as in dacryocystitis, where there would be an inflammatory activity of the tear glands, or there could be an obliteration of the tear gland ducts which can produce excess of secretion, or dry eye conditions where the secretion would be less than optimum. But none of these are now known to be related to any emotional control as such. That's one part. Then the others which are again mentioned in Sushruta but not practically identified in the current situation would be Udgara Vega Bhirti Bhavanti Ghuraha Vikaraha Pavana Prasutaha. If the erectation is suppressed, it can produce many Vataja Vikaras. Of course, Chardehe Vigatena Bhavetya Kustam Yanima Doshena Gredhamannam. If the urge for vomiting is suppressed, that can produce a kushtha. As far as the current no physiological phenomena or pathological conditions which are understood, if the vomiting reflex has become dysenergic, an abnormal control is over there, it can result in conditions of Mallory-Weiss syndrome. Mallory-Weiss syndrome is during the normal vomiting, the esophagogastric junction should be relaxed, and the pressure in the esophagus would be lesser than that of the stomach, and hence the contents of the stomach will flow through into the esophagus. Simultaneously, the pharyngoesophageal junction has to be relaxed so that the esophageal contents will be expelled out. Suppose during this activity, if the pharyngoesophageal junction doesn't relax and it also gets constricted, then the pressure in the esophagus may get enormously increased, resulting in rupture, and that's what we call as a Mallory-Weiss syndrome. Of course, Sushruta has not mentioned about that condition in the Vega Vihata, but Sushruta refers to the kushta, skin disorders which can occur. Now, that skin disorders or toxic accumulation can occur if the vomiting is suppressed with the so-called anti-emetic drugs, Perinorm and so on, regularly if it's administered. Basically, purpose of vomiting is to expel out something which is unwanted by the body, and if you suppress the vomiting activity by such centrally acting drugs, the accumulation of the toxic substances can result in abnormal toxic accumulation in the body, which can result in many complications, and Sushruta says that it is the skin disorders. Then Mutrashe Payuni Mushkoyascha Shoko Rujo Mutra Vinigrahascha Shukrashmai Sravanam Bhavedvate Vikaraha Vihate Shukre. The semen discharge is suppressed, that can produce pain in the genital area, or even swelling in the scrotum, or even abnormalities, urinary abnormalities can occur, or Shukrashmadi, a hardening of the semen. Now, this Shukrashmadi, hardening of the semen, is something which is not physiologically understood, because physiologically semen would have many proteolytic substance like hyaluronate. So liquefaction is the characteristic feature once the semen is discharged out. But a similar situation can occur, similar clinical symptoms can occur if there is a infective pathology like a gonococcal infection, then all these symptoms could occur. Anyway, that's a point which is open for the debate, so I will stop at that point. Tandra angamarda aruchi vibhramaha syuh kshuho abhighata krishalacha drishtehe. If the hunger also is a reflective activity, and if it is suppressed, it can produce a sleepiness, pain throughout the body, or confusion, or krishala, the emaciation also can occur, and particularly vision abnormalities also can occur. Kanthasya soshah shravana vegarodha trishna abhighata hridaya vyathacha, the thirst sensation and the thirst reflex activity is suppressed. If you do not drink water when you feel thirsty, it can result in dryness of the oral cavity, or the hearing could be impaired, or hridaya vyathacha, the pain or discomfort in the chest also can occur. Shrantasya nishwasa vinigrahena hridroga moho athavapi gulmaha. When you do the exercise, you will have a urge for breathing more. That there is, I would not use the word air hunger because air hunger word has a wider meaning, but a increased urge for or increased demand for air would be there. So you will be feeling breathlessness, and that if the breathlessness is suppressed, it can result in cardiac disorder, hridroga, or gulma also can occur. Jrimba angamardo angashiro akshijadyam nidrabhighata athavapi chandra. If the sleep is suppressed, it can produce yawning, pain throughout the body, abnormalities of the vision also can occur, or tandra, a sleepishness could occur. Now, the Krishnaditam, Parikrishtam, Kshiram, Shulaihi, Abhitrutam, Shakradhumantam, Matiman, Udavartinam, Utsujeta. When it comes to the question of treatment, Sushruta gives a priority to the Udavarta produced due to the urge of suppressing the urge of defecation, which can produce retrograde paralysis, retrograde peristalsis in the gastrointestinal tract, or even fecal vomiting, such as severe or obstructive conditions. And according to Sushruta, the patient who is extremely thirsty and who is very emaciated and who is very much disturbed with pain, and if the patient is also fecal vomiting, that condition is asadhya, it cannot be treated. सर्वेषु एतेषु उदावर्तेषु कृष्णसः वायोः क्रियाः विधातव्याः समार्गप्रतिपत्तये सामान्यतः पृथक्त्वेन क्रियां भूयो निबोधमे. In all cases of the Udavarta, the primary aim of the treatment would be to reverse this abnormality of movement of Vata. Movement of Vata is the movement, this normal peristaltic activity should be re-established. Reversed peristaltic activity should be corrected, and hence all the general protocols of the treatment of Vata Vyadhi are applicable in case of Udavarta. Very specific would be Astapanam Marutaje, Snigdasvinne Vishishade, Purishaje Kartavya Vidhi Anahiko Bhaveta. In case of Vata Vega Vighata produced this Udavarta, Astapanavasti is suggested. Purisha Vega Vighata conditions, any treatment which are mentioned in Anaha condition are applicable. And some specific drugs are Saurachaladhyam Madhuram Mutre to Abhihati Beta. If the person has a suppression of the urge for defecation resulting in these neurogenic bladder conditions, Madhira with Savarchala, alcoholic preparations with Savarchalavana is suggested as one of the treatment. Yelam vapi asa madhyena kshiram vapi pernaraha dhatri phalanam surasam sajalam vapi betriham rasam ashwapurishasya gardhavasya athava pibeta mamsopadarumsham madhum vapi bet sidu sagonikam भद्रदार घनम मूर्व हरिद्रा मधुकम तथा कोर प्रमाण पिबेत आंतरिक्षेण वारिणा दुष्स्पर्शा स्वरसम वापि कषायं कुंकुमस्य च येर्वार बीजं तो येन पिबेत व अलवणीकृतं पंचमूलीश्रितं क्षीरं द्राक्षारसम अथा पिबा. The other combinations which could be used in case of the urinary abnormalities could be Yera with the Madhya or Dhatri Swarasa, or the juice extracted from the dung of horses or donkeys, or Mamsa with the Madhu, or this liquid preparation with the jaggery, and so on. Any of these could be, which are generally categorized as mutrala aharas, they are suggested. योगांश्च वितरेऽत्र पूर्वोक्तान् अश्मरीभिदः मूत्रकृच्छ्रकमं चापि कुर्यान् निरवशेषतः भूयोक्षां योगान् यान् मूत्राघातोपशान्ते. The protocol of the treatment of Mutrakritsha or Ashmari can be adopted in case of Udavarta produced due to suppression of Mutra acid. And the other Mutragata Chikitsas are mentioned further in the Mutragata chapter, and they have to be adopted. Snehi Svilehi Udavartam Jrimbam Cha Sampachareta. In Jrimba Jam Sampachareta, if the Jrimba yawning is suppressed in such conditions, Sneha and Svedana is suggested. Akshumoksho Ashruja Karyaha Snigda Svinasirehinaha. Promote the discharge of the tears after Sneha and Svedana if there is a suppression of the tear secretion. Tikshna Anjana Avapidabhyam Tikshna Gandhopashankanehi Varti Prayogehi Athava Kshavasaktim Pravarteta Tikshna Aushada Pradhamanihi Athava Aditya Rashmibhi. If the sneezing reflex is suppressed and hence the patient would have the discomfort, in such conditions Tikshna Anjana or Avapidanasya or any substance which smells, irritated smell would be smelled in, or Vartis can be done, or Surya Rashmi. Direct exposure to the sunlight into the nasal mucosa also can produce a sneezing reflex acid. So induce the reflexes, that's the idea. Udgarage kramopetam snehikam dhumamachareta suram savarchalvatim bija puradasanvitam. If the erectation is suppressed in some conditions, snehika dhumapana is suggested, or sura with savarchala is suggested. Sardyagatam methadosham samyak snehadibhijayet sakshara lavanopetam abhyangam chatradapayet. If the vomiting reflex is suppressed and then the discomfort is produced, in such conditions snehadibla prayoga, sneha, svedana has to be done, and kshara lavana, the yutla abhyanga, application of the kshara and the lavana with the taila over the body is suggested. Basti Shuddhi Karavapam Chaturguna Jalam Bhayaha Avarinashat Pathidam Pitavantam Prakamtaha Ramayehu Priyanadyaha Shukrodavartinam Naram. In the Shukrodavarta, all the Basti Shuddhikara Yoga are suggested, and Basti Shuddhikara Yoga should be boiled till all the water component is removed, so that you will have a solid extract, and that should be given. Or again, stimulus with the sexual activity also is suggested as an option. Kshudvighate hitam snigdam ushnam alpam te bhojana. The suppression of hunger has to be treated with the snigda ushna ahara. Bhojyaha rasena vishranta kshama shvasaturo naraha. If it is a urge for deep breathing is suppressed, in such conditions the patient has to take rest, and then samashvasa aharas, light food has to be given. Nidragate vivekhiram swapyatya istakataha naraha. If the urge for sleep is suppressed and that condition is presented, Kshira is given, milk is given in larger quantities, and the patient has to be in a pleasant environment so that he will be feeling sleepy. Atmanadeshu rogeshu yathasvam prayate yatra bhavet prapam tatra tasmin prayate. In all the conditions as the patient may present with the distension of the abdomen or other such accompanying conditions, whatever is suitable based upon the clinical presentation can be administered. Then Vayu Kostan Gurukshehi Kashaya Katutiktagehi Bhojanehi Kupita Satya Udavarta Karodhi. Another form of the Udavarta is due to excess of vata or abnormal movement of vata due to stimulus with the food, ruksha, kashaya, katu, ahara. If we take spicy food, the vata prakopa would occur, and that is condition, and that condition is called Sadhya Udavarta. Sadhya Udavarta is gastritis. Vatamutra Purisha Asrut Kapha Medo Vahani Vai Srotam Udavarta Purisham Jati Vartayata. If the Udavarta related to the suppression of the defecation can result in involvement of, in due course of time, involvement of more and more structures of the body, like involvement of Vatavah Srotas, Pittavah Srotas, Purishavah Srotas, Raktavah Srotas, Kapavah Srotas, Medavah Srotas also. And hence more serious complications can occur and they have to be prevented. Tato Hrudbasti Shulartaha, Gaurava Aruchipitra, Vasamutra Prishani Kuchena Kurte Naraha. A person who has a habit of suppressing the sperm defecation continuously, he would have pain in the pain in the chest as well as bladder area, lower abdomen, heaviness in the abdomen, aruchi, anorexia can occur, and the patient would have a constipation. Shwasakasa pratishedha daha moha umidvaran srishna hikka shirorogam manashravana vibhramath labhate cha bhunanyana vikaran matakopajana. The other diseases can occur could be Shwasakasa, breathlessness, cough, etc., and Shiroroga, headache, Manavibhrama, inability to concentrate as such, and many other diseases can occur. And in such conditions, tam taila vanabhyaktam snigdham swinnam niruhet doshato bhinnavartiskam bhuktam chapi anvasayet. In such conditions, taila lavana has to be used for snehana and svedana niruhabasti with the lavana taila has to be used. Nacha icchanti व्रजत्येवं उदावर्त सुधारणः अथयन भविष्यत् स्विन्नं विञ्जा स्नेहविरेचनैः पायेतु त्रिवृत्पीडु यवानि अम्लपाचनैः हिङ्गु कुष्ठवचाः स्वर्जि विरङ्गं वा दिलोक्तरं योगवेत उदावर्तं शूलं च निलजं हतः. If you want to prevent the complications of Udavarta, at the early stage itself, Snehana, Svedana and Sneha Virechana are suggested. The Sneha Virechana yoga could be with the Trivritpilu or Hingu Kushtavaja, etc. These yogas could be used. Devadaru Agnikau Kushtam Shunthim Pathyam Palankasham Paushkarani Chamulani Toyasya Ardhadake Pacheta Padavashishtam Tatpidam Udavartam Apohati. Another of the Udavarta yoga. Mulakam Shushkamartam Cha Varshabhuhu Panchamulakam Arevata Palam Chapsu Pakva Tena Dhukram Pacheta Tatpiyamanam Shastri Ugram Udavartam Maheshata. Another of the Udavartahara Ghrita yoga. Ikshvakulam Madaram Vishalyati Shevajam Kushtam Kinva Agnikau Chaiva Pibet Tulyani Purota Mutrena Devadavagni Trifala Brihadi Pibeta. Another of the yoga of Udavarta. Now, majority of these yogas are relevant in the context of Udavarta produced due to suppression of arja for defecation or micturition. Yavaprastham phalai sardam kantakaryaha jaladake paktva arthaprastha shesham tu pibet hingu samanmidam. Another of the yoga where tikshna dravyas are used in the form of kashaya. Madana alam bijani piparim sanidikam sanchurne pradhamet natya Vishati Yatad Yatha Gudam. The another of the Nastya yoga, of course, it may not be considered Nastya because Sushruta has mentioned a protocol where the powders of Madana Bija, Alabu Bija, Pipari, and Nidikdika are blown into the nose with the nadi and they are blown till it reaches to the rectum. This is what Sushruta has mentioned. Practically, you would not be able to do that. To blow into the nose and allow a substance to reach to the rectum is practically not possible, but there could be a slight exaggerated description to suggest about a forced blowing in. So it's not simply nasya. Churnam nikumba kampilla shama ikshvaku agnikudbhavam krita vedana magadhyoho lavananam cha sadhayet gava mutrena tavarti karayet udanugaha sadhya sharmakaraveto yoga amritasammato. The other Udavarti is suggested, which produces a immediate comfort to the patient. With this, we conclude this chapter. It is Sushruta Samhitayam Uttara Tantrantarte Kachikisya Tante Udavarta Pratishedha Nama Sattvadashodhyayaha Adidha Panchapanchashattamo Adhyayaha. If there are any questions, if there are no questions, we will wind up then.